The value of breastfeeding. So when you're breastfeeding and having skin to skin with your babies and with the oxytocin, which is a love hormone that's flowing around your body, helps with your bonding. So as during pregnancy, you're all producing oxytocin, which surges around your body, and it's helped when you stroke your bum, talk to your baby, imagine what your baby's going to look like. If you've got any children already that you want to stroke your bum, talk to your baby, your partners do the same, will raise your levels of already high oxytocin in more abundance. So that's great for why you've already fallen in love with your baby before you've met them for the very first time. But also once your baby's born, the more you hold your baby close, responding to your baby, cuddling your baby, is going to release all of that oxytocin to help you to bond with your baby. I'm also careful to say, though, that parents that choose not to breastfeed their babies will still bond with them, like your partners will still bond with baby, grandparents will still bond with the baby, because it's that loving, nurturing, caring for your baby that will make you bond with your baby. However, the extra oxytocin that's being produced when you breastfeed, that surges at the beginning of the feed, called the letdown, helps with that. So as a result, postnatal depression is at a reduced risk with breastfeeding. Nutrients. So breast milk is full of nutrients. The very first milk that you will produce is called colostrum, and it's present in your breast from when you're about 16 to 20 weeks pregnant. So for lots of you, you may know that you're already producing colostrum because you're leaking once you come out of the shower. For some of you, you might not even know that you're producing colostrum, but it is present in the breast from about 16 to 20 weeks gestation. And it doesn't mean that the ladies that know that they're producing, that are leaking, are going to have any more than the person that didn't know she had it, but it is present in the breast. And colostrum is packed full of nutrients, and everything that's going to be in your milk when it comes in, which is day 3 to 5 after you've had your baby, is in your colostrum, but in very, very high concentration. And I've also got this poster here which shows what colostrum looks like. For many of you, your colostrum will look orangey yellow in colour. This is when your milk comes in. You produce 2 types of milk, the fore milk and the hind milk, so the less fatty milk and the fatty milk. But colostrum is very, very small volume, and nature intended colostrum to be such small volume for a number of reasons, but the biggest one being the size of baby's tummy at birth. And baby's tummy at birth is literally the size of a small marble, so literally just that teeny, growing to about that size about day 5 and about the size of a ping pong ball on day 10. But from birth to about 24 to 36 hours, baby's tummy's only that size, so it doesn't take a lot of filling. And approximately just under half a teaspoon to 2 teaspoonfuls per feed. That's just 2 to 10 mils each feed that your baby will be getting in those first 24 to 36 hours. Immunity, every disease or illness that you've ever had in your lifetime up until now, you would have produced an antibody against. And it's that antibody that's being passed to your baby in those first few days, weeks, months, whilst your baby's building up his or her own immune system. And a child's immune system isn't fully developed until they reach around 3 years old. And interestingly, the very last ingredient or component, if you like, of breast milk that leaves the milk as once you finish breastfeeding is the immunoglobulins, which is the protective against infection. Chest infections, respiratory infections, ear, urinary tract infections, and gastroenteritis are all at a reduced risk with breastfeeding. And that's because of all of the white cells, enzymes, nucleotides, and immunoglobulins that are present in breast milk. Wind, reflux, and colic are reduced because babies that breastfeed have a much tighter seal at the breast, so they don't take so much air down, unlike if they were bottle feeding. So So those things are at a reduced risk. Obesity and heart disease is at a reduced risk because babies that breastfeed are able to control their appetite much better. You can't overfeed a baby receiving milk by the breast because they have to work at breastfeeding. Once they've had enough, they spit the nipple out. Unfortunately, with bottle feeding, by placing the teat into baby's mouth, will cause a sucking reflex. At some point, your baby will attempt to push out the teat with their tongue. If we keep wiggling it around in baby's mouth, we could eventually force feed your baby to take that whole volume. That's not possible with breastfeeding. Constipation, because breast milk is very, very low fat, approximately 2% fat volume in the foremilk, rising to about 12% fat volume in the hind milk, so very, very low fat. So babies, until they start weaning, which is about 6 months of age, very rarely suffer from constipation because breast milk is so light and less fat. Asthma and eczema is at a reduced risk because of the immunoglobulins present in breast milk. Weight loss for mums. You burn off approximately 500 extra calories a day by breastfeeding, so that helps you to get into shape much better after the birth of your baby. These two main things are breast cancer and ovarian cancer, which are at a reduced risk for mums. So when you're breastfeeding and you're pregnant, you're giving your ovaries a rest from that releasing an egg each month. So the prolonged resting of the ovaries that take place when you're pregnant and breastfeeding is what's thought to be protective in reducing your risk of ovarian cancer. Breast cancer, our breasts aren't fully developed until we reach 35 years old. So after each menstrual cycle, your breasts are further developed until the age of 35. If you then go on to breastfeed your baby, further enhancing of the breast tissues and cells that take place when you're breastfeeding is what's thought to be given that reduction in risk of breast cancer. And those two are dose related. So the more babies you have, the longer you breastfeed each baby, the greater the reduction in risk. Osteoporosis is a bone thinning disease, meaning that we're more prone to hip fractures and broken bones. And breastfeeding helps to protect us from osteoporosis. So as your baby breastfeeds, he's taking vitamin D and calcium from your body. Once you've finished breastfeeding, your levels of vitamin D and calcium are topped up to pre-pregnant levels, and then you get a surge in vitamin D and calcium. And it's thought that this surge, each time you have a baby, breastfeed and eventually finish breastfeeding, is what's giving you that reduction in risk of osteoporosis.